Hello everyone, this is Dr. Naz and today I'll be discussing about acute pericarditis. So as the name suggests, pericarditis, it means inflammation of pericardium, and it is acute, it means it will last for a few weeks. However, the chronic pericarditis lasts for more than 6 months. Pericardium is the covering of heart and it has further two layers. The outer one is parietal layer, which is fibrous, and the inner one is visceral layer, which is serous, and there is 50 ml of pericardial fluid between these two layers, which acts as shock absorbent. So pericarditis is usually idiopathic. However, it can be infectious pericarditis, in which viral is most commonly involved, Coxsackie virus and echovirus. Other infectious pericarditis may be bacterial, tuberculous and fungal. Post myocardial infarction pericarditis is also known as Dressler's syndrome, and it occurs after several weeks. Uremic pericarditis occurs in the patient of advanced renal failure when there is increased level of urea in blood. It irritates the serous pericardium, making it secrete thick pericardial fluid that is full of fibrin and WBCs. This gives a butter on bread appearance to pericardium. Other causes of pericarditis may include post-radiotherapy, post-surgery, autoimmune, example in collagen vascular diseases like rheumatoid arthritis, SLE, scleroderma, drug-induced like procainamide, hydralazine, cyclophosphamide, penicillin, anticonvulsants. These all can cause pericarditis. Malignant pericarditis, primary tumors of heart, example mesothelioma, whereas metastatic pericarditis from breast cancer, lymphoma and leukemia mets. So it's just a simple picture of pericarditis. You can see the pericardium and the pericarditis is rough, thickened, and it's restricting the movement of the heart. So the patient will present with chest pain. Chest pain is pleuritic and it is aggravated with deep breathing, unlike MI. And chest pain is positional. It is aggravated by lying spine, by coughing and deep inspiration, and it is relieved by sitting up and leaning forward. The patient may also present with fever, myalgia, right-sided heart failure symptoms like JVP and peripheral edema. There will be pericardial friction rub, which is a diagnostic of pericarditis, and it is usually heard in systole. It is caused by friction between visceral and parietal pericardial surfaces. It is high-pitched, superficial and scratchy sound, and it is heard best during expiration with patient sitting up and the stethoscope placed firmly against the chest. So for the diagnosis, we will perform ECG, and ECG shows widespread ST elevation with upward concavity, as you can see in the figure below. PR interval depression is a very specific indicator of pericarditis. So whenever in the ECG you see PR interval depression, then you must think of pericarditis. Another ECG rhythm showing ST elevation with a concavity and PR depression. So the mainstay of treatment is analgesia and anti-inflammatory agents. So we will give aspirin 600 mg 6 times daily. Non-steroidal anti-inflammatory drugs such as indomethacin 25 mg 3 times daily, and steroids. For purulent pericarditis, we should prescribe antibiotics and pericardiocentesis, if necessary, surgical drainage. For tuberculous pericarditis, anti-tuberculous chemotherapy should be started along with 3-month course of steroids. I hope you learned something from it. If you do, please like my video and subscribe to my YouTube channel. Thank you so much for watching.